We're live.
Hi, everybody. It's Dr. David. Welcome to another Ask Dr. David May edition. So, yeah, it's been an interesting month. We've had some kind of interesting things that have gone on in the world and in our country. And some of those things may be addressed today. But today is going to be an open forum of discussion. We decided not to focus on a particular topic today. For those who do not know, I am David Berger. I am a board certified pediatrician in Tampa, Florida. But welcome to our channel. Of course, if you haven't already subscribed to this channel, please do so and hit the notification button so you know whenever we post something new. And of course, we ask you to please join us over on our Patreon page. The information is down below if you wish to be a patron and wish to support what it is that we are doing here at our channel. Joining us today, as always, is Shari Kulanu, who is our executive producer. So, hi, Shari. How are you today?
I'm great. How are you?
Okay, and Shari is going to be keeping off screen today, and but she will be kind of manning the ship here and asking questions and taking in the questions as we go. Now, as always, we first take questions from our Patreon members. We of course take members questions from our practice, from our patients, as well as members from the first for the community at large. So, Shari, what do we have up deck on deck first?
All right. So here we go. The first question this week is, or this month, do you have any recommendations in terms of supplements or other unique monitoring parameters for pregnant patients who are diagnosed with COVID-19?
That's a good question, especially the parameters part. So. You, Besides the types of parameters that one would normally follow when it comes to a viral infection, a respiratory infection, difficulty breathing, shortness of breath, rapid breathing, chest pain, etc., fast heart rate. And those are kind of the main things that we are going to be looking for, because it's not as if there's like a viral load that means anything. There's not an antibody level that goes I know that we've talked from the so early on about the cytokine storm, and there are test packages that panels that can be done that look at cytokines in general and which ones are up and which ones down. But we know which ones tend to go up during COVID in the first place. And there's nothing that I've really seen that says if this particular marker goes up to a level of this, that means that so and so is going to happen, or that there's more evident risk. So there's really nothing such as that. So following the human parameters as opposed to the lab parameters, from that perspective. Now, in terms of different types of supplements that can be taken, and I know that we have put forth many times our COVID treatment protocols, which now reside over on our Patreon page. Um, Really, almost everything that's listed there, with the exception of the high dose vitamin A, of which we recommend a lower dosing for the vitamin A for pregnancy, is pretty much the same that we are going to recommend for people who are not pregnant. And of course, one of the things that we have done there is we've broken it down into different types of treatments that could be used in prevention mode, and different treatments that could be used on the first signs of illness, and different types of treatments that could be used in order to curb any type of increasing inflammation. Now, there are other things if inflammation is really getting under control, such things such as steroids can be very helpful for people as well. Paxlovid is one thing that's not okay. So you've heard me talk probably about Paxlovid, the oral antiviral medication, but that has not been deemed to be safe during pregnancy. I haven't seen recent information about the most recent um, monoclonal antibodies that are out there. I would imagine that they would be okay to use because they're just antibodies, the same antibodies that people would be developing if they had natural infection, or similar to what would be made during a vaccine induced immunity as well. So I haven't seen recent package. I know that they've been coming out with a few different monoclonal antibodies that are supposed to be more geared, not supposed to be, that are more geared and more available to treat against Omicron and some of the subvariants that we're seeing. But that's pretty much where it is. But of course, hydration, incredibly important, making sure that there are good electrolytes being done. We do not want to get a dehydrated woman in terms of that would reduce the blood flow to the baby, and of course in keeping up with nourishment as much as possible. I realize that when people don't feel good or if there's a stomach bug, they can have a tendency to not eat very much. Making sure as much as possible that good whole food is being taken in. You've heard me talk about broccoli sprouts, and certainly, even sulforaphane, which we've talked about, which is the active ingredient in broccoli sprouts and other cruciferous vegetables, and those certainly can be started early and taken often during this course as well.
Okay, so thank you. The next question that has come in: has GABA been shown to be effective to help with sleep? The person says, I read it doesn't cross the brain barrier. And if so, what would be the minimum dosage for it to be effective?
Okay, so GABA is what's referred to as an inhibitory amino acid. We have GABA receptors in our brains. So, of course, something that's being taken by mouth does need to cross the blood brain barrier in order for it to do its job. And I have absolutely seen those comments that says it doesn't cross the blood brain barrier. GABA happens to be one of the very, very first treatments I started using in children with autism. This is dating back to about 1998. So we're going about 25 years or 99. And despite what that comment and conventional wisdom is, I've seen it help lots of people in terms of both sleep as well as just overall calmness. I've even seen it higher doses it being used to help seizure disorders. And of course, it has to be crossing the blood brain barrier if it's helping out with those types of things. So, I haven't seen any research that talks about this for a long time. I haven't even looked, to tell you the truth, but I've seen it work enough times. And one of the other things about GABA is it's really safe. I don't remember ever hearing anybody having a negative reaction to it. And of course, when we don't have a tremendous amount of research available for anything, asking that most important question of what's the potential benefit versus what's the potential risk. And in the GABA, this is a really, really good place that even if it's questionable if it works or the science hasn't shown it to be effective that way, but it's also very safe. And typically with patients of mine, a very common dosing strategy that I will use is 500 milligrams per dose. Now, some people are using it for daytime calmness as well, and we can go up to 3 times a day with it. But even up to 1,500 milligrams a day is a dose that I've commonly used in my patients that seems to work well. If it's going to work, it's going to work pretty quick. Okay, it's one of those things. Valium also works, and other benzodiazepines also work on the GABA receptor. So, of course, with those as well, when that receptor is hit, we do see pretty quick response to it. Depending on the medication, an hour. But taking GABA for a long period of time to see if it's going to work, probably you're going to know very quickly. You may need to increase the dose to get there. Now, Shari, did I answer all the questions? I feel like there may have been another part to that.
No, I think you did it. One of the follow-up question
Okay.
was really, what's the minimum dosage for it to be
Oh,
effective?
right. So I think 500 milligrams is a starting dose. I mean, if anybody wants to start at 250 and work their way up from there, I think that's fine. But I think that 500 is a nice do something kind of dose. May not be at all. May need to be more, but it's a good starting dose.
Great. Okay, the next question for you is, what are your thoughts on 5-HTP and passion, excuse me, and passion flower to aid in sleep and in their safety, especially in teen boys?
Okay. So I guess we are doing a sleep episode now. Okay. Um, 5-HTP is the precursor to serotonin. So it can work in similar to ways that medicines like SSRIs increase serotonin, although in a very different way. So this is the building block of serotonin. When people take medications like SSRIs, it slows the reuptake, serotonin reuptake inhibitor of it. Both of those, the net result is more serotonin in the synapse to hit the next nerve over. Okay. I don't use a lot of passion flower in my practice. In fact, it's been years since I've even thought about it, to tell you the truth. So I'm not going to have a great answer as to the use of it. I'm very comfortable using the 5-HTP, and boys have done it certainly for years. Of course, and relative to the other question as well with sleep, I would be um, not complete if I didn't put a plug in for CBN, which is one of the cannabinoids that I've been starting to use. I've had tremendous success with it. I'm my own person for the past year and a half in terms of, I've always had no problems falling asleep. But in terms of staying asleep, and again, just like last night, sleeping all night long through to my alarm. Of course, on work days that comes out earlier, but on this weekend, on Saturday and Sunday, I slept till 9:30 and 9:15, which again, I mean, I had, when I went going to medical school and having to wake up when you're on call and buzzers are going off and you lay down and you have to wake back up again, that throws off all of our sleep. And I never really got a good night's sleep after finishing my residency at Tampa General. But in terms of staying asleep, that's where I have really seen a big difference, at least for me. Most people will start off somewhere around 5 milligrams, working up to even 20, 30, 40 milligrams. I'm finding myself around 30 milligrams seems to be a nice dose for me. Um, for those who do use THC, it does seem to have a synergistic effect as well, which is nice as well. So I realized that this wasn't a question specifically about CBN, but being that it is the most effective treatment that I've seen with sleep, I've seen people be able to stop things like 5-HTP and GABA and melatonin using it. So knowing that it's a very safe, very effective treatment out there as well. So I like to give people options so they have all the choices in front of them. All right, Shari, what's the next question that we have? Now, Shari, you appear to be on mute, so if you're talking, I am not hearing you.
Okay.
There we go.
So, thank you. For those of us that have not contracted COVID, lucky you. Which supplements from your immune protocol would you recommend be prioritized to be taken in the event of an infection?
Okay, so then we're going to assume that all of the things that we've talked about, such as optimizing vitamin D and zinc levels, have taken place already. Okay, now, what similar to what I has alluded to before, in my opinion, the single best one treatment for knocking off viruses is still high dose vitamin A, which, as I mentioned before, that's something we do not want to be doing during pregnancy. We want much more moderate doses. As I've shared before, high dose vitamin A is the only known treatment for measles. This is out of the World Health Organization and the CDC. But I was taught many years ago by the first holistic pediatrician that I knew personally, Dr. Eric Ridlin, who's down in Miami, who's now in Virginia, and he had said to me, "I've been using this for giving before and after vaccines for immune support and reducing inflammation there, but also, even though it's in the textbooks for measles, I find that it works for virtually every virus." And so, yeah, that's a good 25 years that I've been doing it, and so many times when people tell me they start our immune support protocol, and I will hear several times a year, yeah, it was the one time that I ran out of the vitamin A, I forgot to do it, I didn't have it, and that's when things got worse. So that is the most important thing. Now, our general immune protocol, of course, talks about doing more zinc and more vitamin C. If people have wonderful zinc levels, they probably don't need to be taking more because it's already there. But if not, that would be a reason to increase it. But we really want to be focusing on the inflammation. It's the inflammation that we know. We've talked about this so many times, cytokine storm, but it's the inflammation that's causing the cellular damage. We've known that from the beginning with the earlier variants when it was causing the liquefaction, the destruction of the lung tissue, and how important it was to do that. And that is one of the reasons why steroids, are being utilized effectively in the treatment of this inflammation before things get out of control, scarred, damaged, etc. We do find bioflavonoids, quercetin, which is something that we've used a lot as well. But, high dose omega-3 fatty acids. But just in general, we want to try to keep our inflammation as low as we possibly can because that's where the damage is happening. The brain fog, the long term things. I mean, we are seeing numbers about long COVID. 20%, 40% of the population. I just saw a study that said 40% of the population of people who have had COVID, even 2 years later, 40% of people are having some type of symptom that's ongoing. Now, that is really sad, unfortunate, and troubling because, obviously it's great that people are surviving COVID, and realistically, nobody should be dying from COVID now. The way that we are, people who, whether it's through vaccination, people who have survived COVID already and have some level of immunity, that all helps in terms of stopping that really severe diseases. Of course, our immune protocols, but again, with monoclonal antibodies, Paxlovid, the steroids, etc. Really, it's really I don't know if I'd call it negligence, but it's certainly lack of knowledge lack of rapidly responding, lack of recognizing when a person's starting to get a little bit more sick that's going down the path, really people shouldn't be dying. So that's kind of like a nice thing, even though, it's tragic. As you probably know, we just hit 1 million official deaths in America from COVID. And that is obviously a very troubling number, that no one would have ever imagined before. Sure. Was there anything else to that question that I missed?
No, I think you did a really good job of answering that. And I did want to let everybody know that if they're not patients of your practice in Tampa or otherwise, that they can access your immune support protocol and other health documents that you're referring to right now on your Patreon site by becoming a Patreon. So,
Yeah,
um,
absolutely, and many other things too that we're continuing to put up documents there where, all kinds of things that I've little gems that I've been learning throughout the years that our patients have access to, but we wanted to make it available to other people as well.
Great. Okay, so the next question is, do you sign paperwork for support dogs for kids with autism? And sort of the context here is says that my daughter has been obsessed with getting one for years. She's now 17. And what would a dog trained for a kid with autism that is high functioning, a teen that's high functioning, do?
Yeah, I have certainly signed letters, forms, etc., for service animals. Some of the ones I've been asked for, like I did get asked to sign for a snake once. Interestingly, though, because like at first I'm like, okay, a support snake. Well, that's interesting. But the young woman, and actually when she came in and it was wrapped around her arm, and she's like, it's providing pressure to me, similar to the way how some people get pressure from like weighted vests and weighted blankets. And with my sensory issues, that it's giving me that calmness, it's giving me that pressure, that sensory input that makes my nervous system be better. And I'm like, well, that actually sounds like a pretty darn good reason now that you explained it that way. And so I signed off on that. Um, I remember that there was somebody who tried to bring a support peacock on an airplane once, and I was trying to figure out how on earth that could possibly be. And it actually made its way through security and got up to the front desk. That was like before COVID, but I'll always remember that. We passed it around our office. We actually got a picture of that peacock, and we kind of passed it around our messages there. We maybe even posted it as a kind of unusual story. But back to the dogs. Okay, as to why a person would be needing it in the first place, that's of course individual. As with everything that we do, but what is a person's need for it? There may be some people who have phobias about being attacked or who about strangers, and it may just serve as a security blanket, if you will. That animal, just the sheer presence may make that person feel more comfortable, knowing that that dog has their eye on somebody going out into public, more crowded places, etc. Some people may just feel from that perspective alone. Okay. I know other people who, let's face it, petting a dog, petting a cat. How lovely does that feel for us? Again, it's our sensory input. So that's another reason why. But there are, even obviously there are service animals can be trained to do all types of things, leading people to the things that they need, etc. So there's obviously not just one reason why a person needs a service animal. But certainly, if somebody explains to me why, in their particular case, they think that it would be a good idea, that it would be helpful for them, hey, that's really important. And we want people to be as inclusive and part of society and the community as possible. And if having something makes that more possible, having an animal makes that more possible, pardon me, more power to you. And so, yeah, it's something that I am a fan of, as well as being a big time dog lover as well. So, I guess I'm waiting to see what the next support animal that I'm asked for that may be a little out the mainstream, and I'll be interesting to see what that'll be.
Okay, so the next question coming to you is, do you recommend neurofeedback for anxiety and or epilepsy?
Okay, I don't have any patients that I recall um relative to epilepsy, but I have seen lots of patients that have benefited with people in the anxiety depression mode. Um, it is certainly some provider dependent situation in terms of that, as well as the technology itself. and knowing how to properly utilize it. Now, thankfully, because many of the technologies, it's kind of like it'll do the scan, it'll kind of collect the data, and then be able to use that data in order to create the individual programs. For people who don't know, it's a often like a computer based type of thing where there's rewiring of neurons and synapses, and that's a lot of times even like with little like mind games that are done on the computer, visual tracking things, etc. And especially if it's done with safe, with proper, approved equipment, it's certainly becoming much more of a mainstream thing. I first started learning about it from Dr. Jerry Gluck when I was down in Miami, and Jerry was one of probably the first five or so doctors in the country, from what I understand. Rest in peace. He did pass a few years ago, and Jerry would be like the main teacher, the main person down in South Florida on it, and he taught me a lot about it too. I was really glad to be able to work with him at the time. All right, Shari, what else do we got?
Okay, so this is something coming from somebody related to news. The FDA just approved the Pfizer COVID-19 booster for 5 to 11-year-olds. The child had 2 Pfizer doses already and did fine with it. Should they get the booster?
Okay. Okay, so, that's a complicated question because obviously it depends on a few things. Okay. Certainly I would want to know if that person, because I've been asked that question in people who actually have had Omicron, and that would probably change my, they had 2 doses and they handled Omicron just fine. And if they had Omicron and were in the age of Omicron, I still feel pretty comfortable that even though the new, what is it, is the BA.2.1.21. I may have those numbers off, but the newest one. It's interesting. The antibodies that are generated to that are slipping off the spike protein because of the 2 different mutations that are in there. So we are starting to hear about people who are getting Omicron a second time. They're not getting sick from it, sick from it, but they're catching it, and of course the potential for spreading it to other people. Now, what about this child? As you know, I've always wanted to know what a person's antibody level is. And now that we can measure the SARS-CoV-2 semi-quantitative total spike protein antibody, you heard me a year ago talking about an antibody level that 2,500 was the maximum that we could record. But now labs are starting to be able to record up to 25,000 instead of 2,500. And that's a very important thing because obviously if you're greater than 2,500, are you 10,000, 20,000, 25,000 makes a difference. But certainly the higher the number is that a person has, then the less relevant probably that vaccine is going to be, and especially if they had Omicron. But not everybody does that. Now, what else do we know? Every time that a person gets a vaccine, the antibody levels go up and then they come down, and they seem to be coming down faster every time a person gets a vaccine. So again, what are we accomplishing there? Does taking a vaccine to provide an additional 4 to 6 weeks of elevated antibodies, how relevant is that? Which of course we don't know because they haven't done that type of research, which is a bit of a challenge here, right? So, but at the same time, when we talk about risk versus benefit, the likelihood that a person who has had, whether it's an adult or a child, if they've had 2 doses of a Pfizer vaccine, because in children, the only Pfizer is the one that's being talked about, and as you may know, with the booster as well. But if a child did not have a problem with taking 2 doses, and especially since those first 2 doses were usually given a few weeks apart, and now there must be, if I'm not mistaken, at least 4 months to get the booster, 6, 4, something like that. But if they didn't have problems with the first 2, how concerned am I that something terrible is going to happen to the kid from the vaccine number 3? I would be very surprised if that was under that type of scenario. I've heard some people who say, "Oh, I had more of a fever this time. Oh, I was a little bit more achy," but I haven't heard anybody who didn't have a problem the first 2 have any major problems with the vaccine. So, maybe if somebody has a big trip coming up that they don't want, that they want to make sure that they're not going to miss out on. They don't want to get on a cruise ship and get to the terminal and then they find out that they tested positive asymptomatically and that blows the whole trip for everybody. Hey, maybe that is a reason why somebody would want to get on the booster. We're doing that for our family, coming up, and it's something that I've been even contemplating in my mind a little bit since I've been boosted and I have no problem with it. Now, granted, I also have tremendously high antibody levels in the 15,000 range. At least when I checked back in March, I'm going to check it again before I would consider truly whether I would do another booster shot. But I also handled the booster shots as well as the first 2 really, really well. So in my situation, how worried am I again that something terrible is going to happen? No, it's just how long is it going to protect me for? Now, if they were coming, if they slash when they come out with a vaccine that is not going to be dependent on the particular strain or variant, um, that's different. And so, if they came out with one that's more universal, would that potentially change around my calculus? If it would provide more than just 4 to 6 weeks of temporary protection against something that's not even really Omicron, well, yeah, that too. So that's kind of the way that I would look at it. But of course, with everything, it's a case by case basis. And I would be happy whether it's in our Dr. David MD consultation education service or whether it's in our office to have that conversations on a one-to-one basis if anyone's not sure which they want to go, but they're contemplating and just kind of want to talk it out a little bit more.
Wonderful.
All right.
Okay. The next question is, what are some breastfeeding friendly supplements when having UTI symptoms but not having yet gotten a diagnosis?
Okay. So first and foremost, if you're having symptoms, pee into a cup and get it tested as soon as possible so that we know what the bacteria is and what will treat it. Okay. One could take Peridium, which is just kind of makes it feel better down there until the infection's under control. But I really haven't found much in terms of natural medicine, in terms of true um, helping from that perspective. I really haven't. I know people will take cranberry. Well, it's certainly safe to do even when you're nursing. I do, cranberry does seem to have a much better effect in a prevention mode. So what it does actually, and it's specific to it seems to be specific to E. coli. So E. coli by far and away, probably 90% of all UTIs are E. coli. And so E. coli, they have these like microscopic, they call them feet that stick to the bladder wall. Now, once it's on the bladder wall, it will take an antibiotic to kill it off in order to peel it. What the extract of cranberry does is it actually stops those feet from sticking to the bladder wall in the first place. Now, if there's a developing UTI, maybe it would stop more bacteria from getting on to be more severe, but I really wouldn't expect it to actually peel it away the way that you would want it to. But I'm not sure if whether in traditional Chinese medicine or in Ayurvedic medicine, there may be some herbs out there that I'm not familiar with. Certainly, I would understand with my limited but knowledge relative to acupuncture, understanding how when where meridians run through and how it can help with pain. Could that be a temporizing measure as well? I would imagine it would, but certainly as soon as somebody has a symptom that's related to UTI, the best thing to do is to test for it. um, very few times do I think that a pharmacological intervention is superior to a natural when there's not a serious thing going on. But just my success through the years, I've used things like golden seal, which is fine to use. I give it to babies also over 6 months of age. Uva ursi is another herb that people can use for it. But I just over the years haven't had a tremendous amount of success with those things. Whereas most people, oh, I'm still not getting better. Maybe it slowed it down, but I haven't kicked it, and then the antibiotics come in. So, of course, a very important thing also is just hydration, 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 just to be able to flush things out as much as possible too.
Okay, so the next question has to do with vaccines, but not COVID vaccines. So the question is for catching up on vaccines, I suppose with their child. The question is, which order would you suggest catching up on vaccines for MMR, varicella, IPV, and DTaP?
Okay, so I'm gonna now part of that question the answer will lie in, well, has the kid had any of those vaccines prior? Okay, how many doses did they have already, and how did they do with it? Okay, now to me, it always makes sense that if we're putting together an individual one by one schedule, it makes sense to me to consider first doing a vaccine of a disease that's more likely to be around. Okay. Now, if we're talking about an infant, a 6-month-old who just didn't get started until then, in my opinion, it's very clear that the answer is whooping cough, the DTAP. And of course, before too long, they would be up and toddling and potentially stepping on the proverbial rusty nail or other things that can cause a puncture wound. So to me, there, that under most circumstances, that is, to me, still probably the most relevant vaccine. Um, and for those little kids, because although they're uncommon, the streptococcal pneumonia and the Hib, because they do cause meningitis and blood sepsis, you know, bad diseases. Again, that's something of a consideration. Now, if I was living in an area or traveling to an area that was high in measles or mumps or rubella, that would certainly sway my opinion. So, if I was traveling to a foreign country or another place, I would, do some searching online to see if there are any of those types of viruses currently in circulation. In the past year, even contacting local health authorities to see if any of those things are around. And if I was heading into a more endemic area for one of those things, that could potentially um, change my calculus. But also, chickenpox. Now, again, it depends on how old is that person. Let's face it, a toddler or a young child, elementary school, who catches chickenpox, the likelihood that it's going to be something really, really serious is incredibly small, if not impossible. We know that as they get older in school, missing a week and a half of kindergarten may not have the same academic impact as missing a week and a half of 11th grade or college, or work, as the young adult becomes the adult, and etc. And we do know that chickenpox in the adult population, especially as they become seniors, is a much more serious disease. Okay. Now, I do certainly know people who would choose to do chickenpox over MMR for this reason. They're made by the same people. The technology being used, the ingredients are the exact same, with the exception of one has chickenpox and chickenpox alone, and the other has measles and mumps and rubella, although they do make an MMRV, V for varicella, so they do make a combination one. But if a person's choosing to split it up, it makes sense to me to expose them to all the inert ingredients plus one virus, in this case chickenpox, and see how that goes before giving an MMR that has three different viruses that a person could be reacting to as well. Because at least if they took a chickenpox vaccine and the person did fine with it, then we know those other ingredients are not likely going to cause a problem, and then one may be more comfortable bringing in the three viruses. Now, our body can handle three viruses at the same time. I'm sure that walking through Publix, we probably get exposed to more than three viruses just from being there. So our body can absolutely handle multiple of ones. I just would be more interested in just trying to keep the number of antigens, so the things that are in there, just like when we introduce baby food, how we say give peas first, and then a few days later give carrots, and then mix it together. So for that matter, if a person had an MMR, and then 3 months later and they did a chicken pox, and then it came time to kindergarten and they had to do it again, how concerned did I at that point would I be if they took an MMRW? Not really. Although I would also tell them in that situation to check your titers, because if a person's had measles or mumps or rubella, or chickenpox vaccine once, there's about a 90% chance that they actually have protection from that already, and we can prove that through the titers. And then, of course, if a person has a nice, robust antibody titer for IgG for one of those viruses, then the relevancy, the additional benefit that that vaccine would give would be kind of nothing. So that's another thing to take into consideration. Not just did a child have it already, how they did, but if they had it, are they protected already? Oh,
Great.
relative to one more comment regarding polio. Okay. While polio does seem to be one of the safer vaccines in terms of, like, I really never ever hear anybody complain about it. Oh, I had a reaction to polio. I'm sure I've heard about it, but I'm just not remembering it, but not like the others. We also want to be recognizing that there is no polio in the entire Western Hemisphere. There were some cases that broke out unexpectedly in Israel last year, which was really kind of surprising, and kind of hoping that wasn't a foreboding thing, although nothing kind of came from that. There are a few places in the world, certain places in Asia and Africa where it is as well. And certainly if someone was traveling to Pakistan or Chad, where I hear the weather is lovely this time of year, that, again, the relevancy, how likely am I going to get exposed, or my child going to be exposed to a virus? And the reality is that, being here, the likelihood is not very much. Now, another thing that I also recommend people do, and do this for Florida if you live here, set a Google News alert. Measles and Florida, mumps and Florida, rubella and Florida, chickenpox in Florida. If polio happens, you're going to hear about that. Believe it. And that way, if there is anywhere in the state, you can see, oh, wow, look, well, was that in the Panhandle? Okay, well, not too close to me. Oh, that was in the Bay Area. Maybe that is a little closer home. So, again, kind of knowing where the infections are, these are all reportable diseases to the health department and to the CDC. And usually they show up on the news because that's the kind of thing that the news does when one of those infections comes about. So, there's, again, you could be more educated to make the best educated decision possible.
Okay. The question is, which labs should I request if I'm a middle-aged woman feeling exhausted lately? Basically looking for some lab ideas that a typical PCP primary care physician may not think to include.
Okay, hope you got your pencils out. So this is not that dissimilar to my basic biomedical workup for any kind of chronic disease. Gut health. That would be something I'd want to know. Is there any candida there, Clostridia bacteria? How's the gut flora, inflammation going on there? Because we know the impact that they can have. Because we do believe that things like chronic fatigue syndrome, fibromyalgia, etc., has a hyperinflammatory autoimmune component. Of course, I'll always talk about vitamin D and zinc no matter what we're talking about, so we can throw those in there. Thyroid levels, not just a TSH, but a free T3, free T4, and reverse T3, which, as you may know, blocks the thyroid receptor and it can make a person have functional low thyroid function, even if the TSH and the T4, which is typically all that's checked, are normal. And then I would want to be very much looking at mitochondrial function, looking at things like carnitine, things like CoQ10. If I was thinking a little bit more along the lines, or other things like ammonia levels, lactate, pyruvate acid, creatine kinase levels as well. And sometimes even doing like a mitoswab that looks at the different complexes that are involved in mitochondria. And as if you may not know, mitochondria produces ATP energy, which is the primary fuel source for our bodies. And so that's an important thing as well. And of course, understanding, how is their B vitamin metabolism, looking at MTHFR, MTR, MTRR, all of the things that we check on our max function test to make sure that people are not just getting B vitamins and other nutrients, but they're getting the right forms that their body knows what to do with it. Or if their body doesn't know what to do with it, giving the right form to overcome that. I probably missed a few there, but that's a pretty good start.
And so that Dr. David is going to be doing a series with our very own Dr. Catherine Nutting, who is a specialist in women's health, and I'm sure that she will be able to chime in on that as well.
Absolutely. Yes, we will be recording that later this week and we will be having those episodes available soon. And if you haven't had the opportunity to work with Kathy before, to know her, um, absolutely brilliant woman who knows just so much about adult medicine and so much about hormones, and a true expert when it comes to like issues related to molds as well. So it will be I'm knowing Kathy, this will be a pretty technical conversation that we will have, similar to when I had our wonderful conversation with Dr. Ben Lynch when we got really into the details of B vitamin metabolism. But it seemed as if most of our listeners were able to follow along. And one of the things when Kathy or whatever explains things, if it doesn't seem crystal clear as to how we apply it, or what it means, I can kind of come in and Dr. David explain it a little, also. So yeah, so be on the listen for that, because you will hear things that'll come out of that appointment. I mean, of that interview series that I have not talked about before, and quite frankly, I'm sure I'm going to learn a thing about it too.
Great. So here is a question that is right up your wheelhouse, two of your areas of specialty. The question is, do you use medical cannabis to treat children with autism? And if so, how? And I want to chime in by saying, whoever asked this question on the interwebs, if you are in the state of Florida, especially if you're in the local Bay Area region, encourage you to check out our Dr. David's Holistic Relief website and clinic. After he'll provide you an answer now, but that may also give you some additional information in helping you decide.
Yeah. So the way I look at it is, we're not treating autism. We're treating symptoms of autism that are debilitating, that are impactful, whether it's on the family, on the child, on the school setting, etc. So I never would think of this as a cure for autism. Not that I really talk about anything for a cure for autism, but so if some children may be very picky and not wanting to eat, certain versions of THC can be very helpful as an appetite stimulant. If people are having anxiety issues, things in the CBD, CBG realm can be very helpful. If they're having issues with sleep, then things in the CBN realm and some indica THCs can be very helpful. So it really does depend on what it is. Now, if somebody said to me, I want you to give me a form of cannabis to make my kids sleep, to speak. Well, I haven't really come up with the speak one. Okay. Now, one of the things I have seen in some children who have limited speech, but maybe be on the shy side or a little bit more reserved, is I have seen kids who um, are limited in their speak more because maybe it's making them just feel more comfortable in their own body, making them feel a little more social. Social anxiety. It certainly can help with things like that as well. But I really wouldn't expect it to like start producing words in a child who had not words beforehand. Okay.
Okay. I know you have a lot more to say about that topic related to how medical cannabis can be used for pediatric health in general and various conditions. I believe you have some other videos on that, and I'm sure
Yeah,
there'll be
we've
more
done videos. Yeah,
forthcoming.
if you check on our Dr. David MD YouTube site, I'm pretty sure that you will go back and see some videos on that as well, more detail.
Okay. Another question coming your way. What would you recommend for kids who get frequent viral respiratory illnesses?
Okay, so it is a rite of passage to start off with. The first year, whether it's in daycare, preschool, kindergarten, the first year that a child is around a bunch of other kids, they average 10 colds that first year. Now, cold symptoms can last up to 2 weeks, and that's considered normal. Cough can last up to 4 weeks, and that's normal, which means that it is not abnormal for that child to have 20 weeks of runny nose or 40 weeks of coughing, and you would think my kid's sick all the time. Oh my gosh, there's something wrong with their immune systems. And of course, that doesn't happen to everybody, but that is considered normal. That's considered accepted within the pediatric world as okay, rite of passage. We're building up antibodies to each of those viruses. There's a reason why older kids get sick less. There's a reason why us in the pediatric provider world, why we rarely get sick, because we've seen so many of these bugs every single year. I've been seeing, I can't even imagine how many bugs I've been exposed to over the last 25 years, but I also seem to have a super immune system. Now, maybe some of that is also coming back to our vitamin D and zinc conversation, because I clearly have seen kids who have come in with these illnesses over and over and over again. And we do some of these types of nutritional support. And again, other types of things, avoiding things that are high in inflammatory foods, whole foods, etc. That can be very helpful. And so the main thing, again, following our immune support protocol on the first sign of illness is kind of the thing that we very often, I know in our family, how many times when our kids were younger, we would count how sick they were in hours as opposed to days because of the added immune benefit that we are able to give them. All
Okay.
right. Yeah.
Ready for your next question? All
Sure.
right. Question for you all. If you have gotten both the first and second COVID-19 vaccination, but then get COVID during the last Omicron surge in January, do you need a booster now?
That is a good question. Now, I would say a couple of things. If a person got over Omicron and it wasn't a terrible disease by them, because we know that even these newer subvariants of Omicron, they are all the much more contagious, that they are milder. More information came out about that just a couple days ago. I would ask a simple question. How sick did that person get during Omicron in the first place? Because more likely they won't get as sick as that. So that's kind of a good thing to know, even though it can't say that they're not going to get sick. The likelihood that they would get sick would be really unlikely. Okay, so that's something to take into consideration. But there are cases where people have had one Omicron, and now that we know about all these subvariants, have gotten another one. So the take-home message should not be because I had a couple vaccines beforehand, and then I got Omicron, so I've had multiple exposures to spike protein. I am now Superman, Superwoman, super person, and I cannot get it. I have, it's not my kryptonite. I will not get it. That's not true. But what we can talk about is severity. But there is so-called that same lingering long COVID aspect, because we know that there are people with minimal disease and who had, are asymptomatic who still get long COVID. Although there is some data that shows that the people who are most likely to get long COVID are also the people who had no immunity beforehand. So there wasn't any antibodies to help start batting down the virus to stop, which is one of the things that stops the immune system from kicking more into gear. Those are the kind of the things I would take into consideration.
Okay, we have two more questions that we have time to get to today. The first one is, what do you recommend for treating thrush?
All right. So for people who don't know, thrush is Candida albicans, and it most commonly will occur in healthy people who are infants, especially those who are nursing, as well as nursing moms on their breasts. Okay. Now, in other populations, people with immunodeficiencies, HIV, AIDS, cancer patients on chemo, etc., that's a whole nother thing, and that would probably need to be treated more aggressively. Okay. Um, One of the go-to things that I do naturally is called Jensen Violet. Any health food store will have this. It is a deep purple staining thing, so do not have your Saturday or Sunday best on when you're doing this, and don't bring out the new towels at that point in time, because your entire essence and your baby's essence will become purple. But it's very effective in terms of treating the yeast. And whenever doing that, you always want to make sure that even if the mom's not having symptoms but she's nursing, you still want to treat the mom's breast, because it's probably on there even if it's not causing her symptoms, and you don't want to just give it back to the baby when that's done. Now, the next thing, which can be very effective and is very safe, is nystatin. This is a pharmaceutical that does not get absorbed into the bloodstream. Both the Jensen Violet as well as the nystatin should be applied several times a day, but you also want to make sure it's being painted on. So it's not something that you want to just drink on down. Whether it's on a finger, cotton ball, Q-tip, or whatever, you really kind of do need to paint the surface on tongue. Granted, your baby may gag a little bit because you're messing with your baby's tongue. Roof of the mouth, that's another, it's usually the inner cheeks, the tongue, or the roof of the mouth where it will appear in the first place. Now, if I do have a more severe case of it, or if I see that the baby also has a diaper rash that looks candida yeast related, if they have it here and they have it down there, more than likely they have it somewhere in between as well. So that would be a reason why nystatin can be swallowed down for that purpose to treat more in the gut. But that might be the time where we do need to do a bigger gun, like fluconazole, diflucan, because that treats every place in the body like that. So it does depend on where it's at and where the spread has been at. Okay, Shari, you're muted again.
Okay,
There you go.
the last question that we're going to have time to get to today, and I want to let all of our listeners know we had a lot of questions come in today. This monthly offering that Dr. David is doing is definitely picking up steam. I believe this is our third one, so the questions are becoming more common. And what we're doing is we are allowing our patrons from our Patreon page. Part of a perk of being a Patreon member is that your questions get answered first. So as Dr. David's show continues to grow, if you want to make sure that your questions get answered, please consider joining him on Patreon. Okay, so the last question that we have coming is, and I know this isn't an area per se of expertise, but I'm sure you have some thoughts on this. I just received a dementia diagnosis. Now what?
Okay, well, I'm sorry to hear that. Um, Dementia is a very broad term. Part of the issue needs to know, why is this Alzheimer's disease? Is this post-stroke? Is this post a cardiac event? Because the underlying reason could very well dictate what the proper treatments could be. Okay. Now, we know that people who have dementia, we know that there are things like getting good exercise. I've looked into this. We've been dealing this with family. We know that one of the absolute most important things is getting exercise on a daily basis, keeping the blood flowing, active, etc. Also, doing mind exercises, whether it's puzzles, crossword puzzles, reading even video games, because there's actual brain, which is different than watching TV where you're just kind of observing, whereas a video game you're interacting. So things that are interactive are more stimulating to the brain to help keep that function alive. I know that there are medications that are out there. That's something way beyond the realm of this pediatrician here. But would I be looking at things that are antioxidants, things like glutathione and acetylcysteine, etc.? Certainly can't hurt, and any of those things, if there is some level of inflammation going on, then that can be helpful as well.
Okay, and as I mentioned, we are going to be out of time for today. So
Yes.
I'm going to let you wrap up the show, and thank you for letting me be off screen asking you questions.
Absolutely. So again, putting out the call for joining us on our social media and on this journey together. We're inching closer to 1,000 members on the YouTube channels. I think I looked, we're around 825, and we'd really like to be able to get those numbers up. So please share it with your friends and tell everybody about it. And please go back and watch our videos if you haven't. There's this thing where if we have 4,000 viewable hours within a year, there is some kind of perks or something. We get a, I don't know if we get an award and a plaque. I don't know, something happens. But when we get those types of viewerships, one thing I do know is that we do get found easier on the search engines, which is nice because if you want to be able to share what we're doing to somebody you don't even know, the more people who watch our shows, the more likely that other people are going to find us even just by happenstance through a search engine. But also, we do have, I do have my monthly newsletter that we put out. We put in different highlights, comments, etc. And people can sign up from that at drdavidmd.com. So thank you so much for listening. It's been great. I really enjoyed having the questions, kind of like when I'm in a consultation with somebody where I don't know what questions, when we do our shows, we do have to do a little preparation. But I love doing these types of shows because I love being put on the spot and just kind of having to think through an issue. And sometimes I get asked questions I had never thought about before, and you get to see the old noggin working right there in front of you. So thank you everybody much, and have a great day, and hope to see you again